Hey everybody, it's Dr. Gaffney from Dr. Gaffney Best Foot here today to share tips and tricks what has helped thousands of my patients over the years. And today we're going to talk about heel pain caused by plantar fasciitis, new onset heel pain. And first and foremost, I want to say that this is not a doctor-patient relationship. This video is not intended to diagnose, treat, or prevent any disorder. You need to consult your medical doctor, and this is not a doctor-patient relationship. So anyway, let's get into it. Okay, so first off, you need to have a proper diagnosis from your doctor. So not all heel pain is plantar fasciitis. So it could be a stress fracture, it could be gout, it could be autoimmune problems, it could be a thin fat pad where you don't have enough fat down there to cushion your heel when you walk. That happens more so in older patients, elderly patients, but it can happen. You could even have like a fissure in the heel, like a skin fissure from dry skin causing heel pain as well. So it's important to get a proper diagnosis before you go into treatment. And what is it? How does it happen? Well, first off, the plantar fascia is a long ligament. It goes from the ball of the foot, like if this is the ball of the foot, it goes in a long ligament from the ball of the foot to your heel bone. So there's the point of the triangle is at the heel. And so there's a lot of tension there. And over time, you can get little micro tears if you don't keep that supported, or if you're carrying a little bit too much weight, it can cause a lot of strain at that heel bone. And you get little micro tears and inflammation comes in, and it kind of goes on and on until you get it treated. There are some lucky folks that it goes away without anything, but most people are not that lucky. So anyway, so what do we do about it? So the first thing on the list is stretching, and stretching a lot. So the ligament, it gets tight and stiff. So one of the telltale signs of plantar fasciitis is getting up out of bed and the ligament pulling. So we try to limber that ligament up. So the main stretch that I recommend is a towel or a belt or one of those TheraBands from physical therapy. You put it around the ball of the foot with your knee straight, and then you pull your forefoot back and towards yourself, and you hold it about 10 seconds, and you'll feel a little bit of a tension there. It should not hurt. It should just feel a little bit of a pull. If you have pain when you do that, just back off and stretch at that point. You don't want to make it hurt and get it worse. Another stretch that you can do is up against the wall. You put the ball of the foot up against the wall with the heel on the floor, and then you lean your body into the wall, and you'll feel that stretch down there. Third way to stretch is the ball of the foot on the edge of a step. You drop your heels down and hold the stretch about 10 seconds. So I recommend doing those stretches about 10 seconds, 3 sets of 10 twice a day. Or you can even do it 3 times a day. Anytime you see a wall, just put your foot up there and stretch it. So those are all good stretches. Another way to stretch out your plantar fascia is wearing a night splint. It tends to get real tight at night because the bedding pulls the foot down, and when the foot's pulled down, it'll get real tight. So the type of splint that I most recommend is an anterior splint. So it goes on the front of the leg and the top of the foot. They sell it at Amazon, I think for around $25. You can also get it at Walgreens, Walmart, and we'll put links to that in the show notes there. So you wear the splint all night, and you get up in the morning, and usually it resolves your heel pain. It's great. That's if you can wear it all night. Some people cannot wear it all night, that it feels too confined. But so if you can't wear it all night, I would just like slip it on when you get home, when you're chilling, when you're eating dinner, work on the computer, when you're sitting down. If you wear it, I'd say if you wear it like 2-3 hours a day, it'll help you. So splint, stretch, strengthen the little muscles on the bottom of your foot. So there's 4 layers of muscles on the bottom of your foot, and if you strengthen them, they'll take the strain off of the ligament. Most people have weak muscles down there anyway, so the strengthening should be helpful. So you either can do towel crunches with your toes, you can do ankle rolls or any movement down there. So I would do maybe towel crunches for about 3 to 5 minutes every other day to try to get those muscles strong and take some strain off of that plantar fascia. Next thing, resolving inflammation. So One way to do it is ice at the end of the day. So when you come home from work or anytime you have a bout of weight bearing, just ice it about 5 to 10 minutes. Um, and also another way to get rid of inflammation is rest. So rest is a key part of resolving this. So if you've had, if you can get a light duty at work, that'd be great. Try to eliminate your weight bearing exercise, at least for now until you're well. You could swim, you could do stationary bike, you could weight train, but try to eliminate any running, jumping, that type of thing. Depending on how bad the plantar fasciitis is, sometimes I allow my patients to continue to walk as long as it's not getting exacerbated and they're keeping it supported. So rest is important. And if you can get light duty at work, of course, that helps too. Another way to resolve the inflammation is getting Voltaren gel if you're not allergic to anti-inflammatories. So anti-inflammatories, aspirin, ibuprofen. If you're allergic to that, you probably shouldn't use Voltaren gel. But anyway, Voltaren gel is over the counter now, so which is great. I would use a gram of it on the bottom of the heel twice a day, and that's usually what I recommend to my patients. If that doesn't work, many times with my patients, I do a series of cortisone injections. But if you're catching this early on, many times you don't have to go through the cortisone injections. And last but not least, support. Support is vitally important. So that ligament strain, you got to support it. So the two types of over-the-counter orthotics, which will support the plantar fascia that I recommend, are either spenco orthotics or sofsoles. Spenco orthotics, you can boil them and mold them to your foot, and then sofsoles are good as well. You have to go through an adjustment period. So you wear an hour the first day, increase by an hour every day until you're wearing it all day long. You got to take the insole out of your shoe to slide the orthotic in there to give you some room. I know some people don't like wearing shoes around the house. If you could just get a shoe that you just wear in the house, use it as your house shoe, put the orthotic in there, that would be great. You want to avoid all barefoot, stocking foot, slipper, weight bearing. Bare feet will strain the fascia, flip-flops, that type of thing, all strain the fascia. If you don't want to use a shoe, you could use like a Birkenstock or one of those supportive sandals, Birkenstock Naote, Vionics, Keens. Those are all very good as well. And so if you do all those things and you're faithful with it, most of my patients would get better. I know a lot of people do not stick to the plan. I mean, I've been a doctor for decades, and most people do not stick to the plan. But if you do these things, and if my patients did these things, they're like, wow, this got better in 2 weeks. It won't be like 2-3 months from now and suffering from the heel pain. And it will steadily get worse unless it's treated. So follow the plan, it'll get better. So the key is consistency. So I would venture to guess if it's new onset heel pain and you do those things in about 4 weeks, be feeling pretty good. So once you're feeling good, you got to prevent recurrence. So if it was, I mean, if you're a little bit overweight, you probably need a health coach to help you drop some pounds. We have an inflammatory diet in America nowadays, and that creates all these problems and creates the excess weight. So a health coach would be great. You could get rid of the inflammatory diet that help you lose weight, help you be healthier all around. If you have bad shoes, change your shoes. And I will list some good shoes in the show notes, as well as links to their orthotics and the splints and that type of thing. So anyway, to prevent recurrence, I would wear the orthotics 75% of the time for the next 2 to 3 months after the patient is asymptomatic. And then after that, just when you're going to do a lot of weight bearing, like if you're going to go food shopping or to the mall, I'd still wear the orthotics. And then if you really want to get your foot strong and get rid of the orthotics altogether, you have to focus on those strengthening those foot muscles. But I would say anytime you have a twinge of heel pain after you've kind of weaned yourself out of the orthotics, I'd put them back in and wear it. So you kind of gauge how you're doing as far as when you want to get rid of your orthotics and whatnot. But if you're lucky enough just to have this as a new onset heel pain, you can probably wean yourself from the orthotics. The other way to prevent recurrence is doing stretching at least maybe a few times once a day for about 2-3 months after your pain resolves, and using the night splint maybe once a week for about 2-3 months afterwards as well. And then after that point, you could probably wean off of everything. My patients could. And then if there is twinges of pain, then introduce some of these things back in as needed, and just kind of be cognizant of that. You don't want to set it off and have it get bad. So just have these things at the disposal to use when necessary. So I hope this helps you. I do have a blog that details it very well on Dr. Gaffney Bestfoot at WordPress. I'm going to have the link down there in the show notes. If please like and subscribe, and leave me any questions or comments, and I will do my best to help you. Again, this is not medical advice, and you do need to see a doctor about this problem. But this information has helped most people if you do it. So good luck, and we'll see you next time. Thanks for watching.